You know that feeling when you're handed a page of dense, handwritten medical notes and it feels like you're trying to crack some kind of secret code? Well, that's exactly what we're going to do today. Hidden in this single page are the keys to several major neurological conditions, and we're going to decode them together. Think of this page as our treasure map, and the goal of this whole explainer is to turn these scribbled phrases into memorable, visual knowledge, clues that you can actually use, whether it's for diagnosis, for your exams, or hey, just to learn something cool. So let's dive in. First up, we've got Wilson disease. So what is it? It's an autosomal recessive disorder. Basically, a faulty gene messes up the body's ability to get rid of extra copper. So that copper starts to build up and it becomes toxic, especially in the liver and a deep part of the brain called the basal ganglia, which is super important for controlling movement. And that's why it also gets the name hepatolenticular degeneration. Okay, so that leads us to the big question, right? If you've got all this copper piling up inside the brain, what does that actually look like on a scan? What's the telltale sign that a radiologist is hunting for? Well, the answer is hiding in plain sight. Right here in our notes, it's an absolutely wonderful descriptive phrase, a name that, once you hear it, is pretty much impossible to forget. And there it is, the face of the giant panda sign. How cool is that? This name perfectly describes the pattern you see on an MRI, where some areas are bright and others are dark, and it literally looks like a panda's face. It's the perfect example of how a memorable visual can just unlock a diagnosis. From now on, you think Wilson disease, you look for the panda. All right, let's move on to our next condition. We're actually sticking with a similar theme here, metal building up in the basal ganglia. But this time, we're swapping out copper for iron. This is NBIA, which stands for neurodegeneration with brain iron accumulation. And it's exactly what it sounds like. Iron is building up in that same critical area of the brain. So we've got a different metal, but a similar problem. How does this toxic iron buildup show itself on a scan? Are we on the lookout for another unforgettable visual sign? And you guessed it, once again, our notes give us the clue. It's another powerful, evocative name for what you see on that scan. The eye of the tiger sign. Now what's really cool is how specific our source notes are here. They tell us this sign is seen in the globus pallidus, which is a key structure inside the basal ganglia. The iron deposit creates this dark ring with a bright spot right in the middle. So for NBIA, you're hunting for the eye of the tiger. Okay, so we've seen what happens when metal's built up in the brain. Now let's totally switch gears and pivot to a different kind of problem. This one affects the brain's wiring itself. We're talking about disorders of myelin, that crucial insulation that coats all our nerve fibers. Our first example here is Pelizaeus-Merzbacher syndrome. The notes call this a leukodystrophy, which is just a disease of the brain's white matter. The real issue is hypomyelination, which is a fancy way of saying the brain just doesn't produce enough myelin to begin with. So if you've got this widespread lack of critical insulation, it's going to create a very distinct pattern on an MRI. What are we looking for this time? It's called the tigroid appearance. And this is what I find fascinating. It's not just some random name. This pattern looks like a tiger's stripes because some myelin is still preserved around the blood vessels. So you get these bright stripes against the dark background where the myelin is missing. It's a direct visual of what's going on. All right, let's get to our final condition, multiple sclerosis, or MS. Now, pay close attention to this because it's a subtle but really critical difference. This isn't hypomyelination, a problem of production. This is demyelination. The myelin was there, but now the body's own immune system is attacking and destroying it. The notes here give us a fantastic clinical snapshot. MS often hits the optic nerve. The classic presentation is a female patient, often of Northern European descent, who has a sudden problem with her vision. You know, that clinical context is absolutely crucial when you go to interpret the scans. So when the body attacks its own myelin, it leaves behind these little scars or lesions. And these lesions have a classic name and a very particular shape that we're looking for on the MRI. So we go back to our map one last time. And right there, the notes give us our final clue, a name that perfectly describes the unique shape of these lesions. Dawson fingers. It's such a brilliant name because it perfectly illustrates the shape of these MS lesions. They're periventricular, which means they're right up against the brain's fluid-filled ventricles, and they radiate outwards, perpendicular to the ventricles, just like fingers pointing out. This is a total hallmark sign of multiple sclerosis. So let's just quickly put these two side by side. With Pelizaeus-Merzbacher, you have a production problem, a lack of myelin, and that gives you the tigroid appearance. With MS, you have a destruction problem. Existing myelin gets attacked, and that gives you Dawson fingers. Two totally different mechanisms to very distinct signs.
All right, we've decoded the entire page. Let's do a quick, rapid-fire review just to lock in these 4 key signs for good.
And here it is, your final cheat sheet. 4 conditions, 4 unforgettable radiological signs. For Wilson disease, we're looking for the face of the giant panda. For NBIA, it's the eye of the tiger. For Pellezanes-Marcherbacher, it's the tigroid appearance. And for multiple sclerosis, it's Dawson fingers. We took a really complex page of notes and turned it into a clear, high-yield summary. So we started with a cryptic map and we ended with 4 clear diagnostic landmarks. The only question left is the next time you're looking at a brain scan, which one of these amazing signs are you going to spot first?